Item number 2 is a special presentation, a COVID update from Johnson County Public Health, Sam Jarvis, who is the Community Health Division Manager. Welcome, Sam.
Hey, good afternoon, everyone. Thank you for having us. Happy to provide an update where we're at as a community in terms of COVID-19, but I can imagine specifically around surrounding our vaccine planning efforts. So to give a quick recap, since September, we've been really dual-hatting our role in COVID disease investigations and vaccine planning. We were able to participate with a statewide planning group from September since then. And as every month and week has gone forward, we've learned a little bit more information as it slowly trickles out from our state and federal partners. Fast forward to December 14th, we were lucky enough to see the first dose of Iowa administered here in our very own backyard here in Iowa City at the University of Iowa hospitals and clinics. And even since then, December 14th, only 36 days roughly past, more information continues to change daily, if not, or weekly, if not daily. But since then, since December 14th, Johnson County has been allocated roughly just north of 15,000 doses. And I'll distinguish that those are initial doses. And the reason why is because we expect to continue to receive our allocations for the second dose. The state has gone ahead and planned that for us. And so really it's not out of sight, out of mind, but for all intents and purposes, we can expect those. And so long as we're keeping track of where we are allocating, we just follow behind that same path that we've been taking. So really, looking at 15,000 plus doses allocated to Johnson County to cover our very large phase 1A population or healthcare workers and long-term care staff and residents. But since then, we have been monitoring several things. One of those are our allocations that we've received. The other is the federal pharmacy partnership that is serving our long-term care facilities, specifically skilled nursing facilities, assisted living, and there are several other facilities that have been able to enroll in that federal program. And since then, it's been sparse with some of the allocation that we've received week to week, but knowing that we've had or have a very large healthcare workforce here in Johnson County, and knowing that there's somewhat of a commuter effect where there are many healthcare workers that work here in Johnson County but live elsewhere, we've expressed those concerns to the state where more than likely the initial planning numbers that the state had utilized based off of license data. And so really you could read that as or hear that as where persons reside, where the licensed person resides, that those numbers would be an underestimate. And so this has occurred not just for Johnson County, but for other larger areas within the state of Iowa. And so several local public health agencies and their partners had also expressed that as well. So we're in good communication with the state on those issues, and they've recognized that. And just as of the last week and a half, we've seen a small bump in our allocations. And so really thinking about what announcements were made this past week for the next priority phase that the state is anticipating to start February 1st, we are playing catch up, so to speak, so that we can continue making good progress to vaccinate all of our healthcare workers going forward, so we can be ready for priority or the next phase 1B to start. That's really the high level overview of where we're at now. I think the past couple of weeks, our team has reached out to several dozen, if not hundreds of individuals and organizations that are healthcare workers. We are being thoughtful in allocating to our large healthcare system organizations, but also making sure that we get doses for other healthcare facilities in Johnson County that are not affiliated with a large hospital. And so much of their time has been spent communicating with them and really looking to assist to prioritize. And part of our larger strategy is to utilize and leverage our partnerships with other COVID-19 vaccine providers, which Johnson County has many of. And we're very fortunate and very grateful for those partnerships at our pharmacies and other facilities that are willing to provide vaccinations. And really that is the overall strategy for the entire state and many other states as well, to have recruited other medical facilities to provide vaccinations, because it cannot be done by one facility alone. It cannot be done by one large mass vaccination clinic. We recognize that with the vaccines that we have available to us today, require a lot of logistics, let alone the fact that it's a 2-dose series. The vaccines require very unique cold chain management. And so certainly we want to be sure that those doses are being handled appropriately and being planned out appropriately, so that there's no waste at all. So really we've been referring to it as a zero waste strategy with our partners. And as soon as we are being allocated doses, we want those sent to our partners, and knowing that they'll be used within the week or the next coming weeks. We do know that the state is looking at some soft metrics of doses allocated versus doses administered. So we've expressed to our partners that we will continue to allocate as quickly as possible throughout the county, and to our partners with the expectation that we can administer those doses pretty quickly. So having said all of that, happy to take any questions and provide any clarity on what we've been working on and our steps forward for phase 1B.
Sam, thank you very much for everything that you do. I just want to ask you, because there is a question has been raised by a lot of people. Even though right now the vaccine is available for healthcare worker, I'm just asking, when the vaccine become available for the public, do you think that will cost money for the people who don't have insurance? Especially, I'm talking about low income who don't have insurance.
It should not. So there are instructions by the state where providers are not to charge or balance bill. There is an administrative fee that they can bill to insurances, but obviously if someone doesn't have insurance or uninsured, there are provisions for that. So that is information that's available, and we certainly express that to our partners to make sure that that communication is given to all folks that they're serving.
Sam, once the other categories open up, how are people going to be scheduling appointments? Is there going to be information on, I had somebody ask me this today who thought their section had opened up, which it sounds like it hasn't. But yeah, how are people going to be finding out where they can get it and when they can get it?
We are solidifying a lot of that information this week with our partners. But what we hope to provide is a very methodical guidance on where, if you fall into one of those groups in the next priority, phase 1B, you'll know exactly where to go. We are wanting to make sure that all those priority populations are commence February 1st, if that's what the state chooses to do, and that each group has very clear guidance on where to go, so that it's not, well, we've got 20 sites that can serve or vaccinate folks, and just pick one and good luck. We're wanting to avoid that. We're wanting to avoid confusion, long lines. And so it will probably appear to be a pretty heavy hand on where persons can go, and we're doing our best to be thoughtful on access. But what we want to do is make sure that it's not confusing, that people are able to, in terms of either transportation and time, but also thoughtful in the sense that we are making sure that there's no competing interests at one location because of good access and things like that. There are also other kind of guiding metrics that the state has released, that 50% of the vaccine allocation is requested to be dedicated towards priority populations per age. Then the other certainly for underlying health conditions, which we can expect more guidance in the future. So again, those are kind of the softer metrics that we're looking at to what we've called load balancing, for lack of a better term.
Thank you so much, and thanks to Johnson County Public Health for all that you all are doing. I know that I speak for our counselors and for Iowa City, where we really appreciate the opportunity to have the vaccine in our community. And it sounds like it is certainly a challenging effort that you all are doing, but you're navigating it to the best of your ability and making sure that the public is notified is going to be key. So thank you again.
Yeah, thank you. And a huge thanks to all of our partners who are vaccinating. It has been a challenging and complex issue to navigate, but we're very appreciative of all the support that we've received. So thank you.